we're live. Anybody see us live yet? No. Hello. Anybody see us live yet? No. Hello.
I got him.
Are we live?
I
Weird. Facebook always changes what they do. I mean, Zoom, I'm sorry, not Facebook. Okay, yeah, we are live. Hi, happy Thursday.
Happy Thursday.
Welcome to our Good Girlfriends chat. We are so excited because this is our first Good Girlfriends chat of 2024. And the reason it's our first chat of 2024 is because I'll say we decided that menopause was going to be the first discussion we had this year. So we were waiting to get on the calendar of our dynamic guests, Dr. Gail McDonald and Dr. Amira Clemens, so that they could share with us everything we need to know about perimenopause, menopause, postmenopause, anything with the word men and pause in it, we need to know about it. So welcome. I'm Cara, and I'm a regular, so I'll pass the mic over to Regina now.
Hello, everyone. Oh my gosh, we have missed the good girlfriends. And just because we're not here does not mean we're not connected, because we are connected to all of you in so many different ways. But we are excited, and I'm excited about this topic tonight.
So I will just say welcome back to the virtual living room. It's been a little while. At one point, we were hitting this every Thursday, it seems. Then we went to every other Thursday. And now it seems like maybe we're on a once a month jam. But this topic is extremely important, as we are all the good girlfriends on here. I'm not sure if we are all in menopause or different stages, but we are of that age. And this topic is so very important, especially as it impacts how it impacts Black women. And so I'm so happy to have the panel that we have today. And I can't wait to just kind of jump right into it.
Yeah, and for anyone who is viewing this live, feel free to put your questions in our Facebook live post. And if you don't want to share on Facebook live post, I understand. You can either send an instant message to a messenger message or text if you have our phone number, whatever you want to do. For privacy's sake, that's fine too. But we do want to get the questions answered for you and share as much information as we can tonight. So let's jump right in. First, I just want to say thank you again to both of you for taking this time to talk about this very important topic. And if we could start with definitions of what perimenopause, menopause, postmenopause, if you can give us definitions for those, that would be a great starting point, I think, so that we can figure out where we are on this life's journey.
Right. Well, greetings, everybody. I'm Dr. Gail McDonald. I'm right here in the DMV. I am one of your traveling docs, so I get the chance to work in multiple centers and hospitals and really get an opportunity to really talk to folks on a regular basis, whether it's in the office or finding them in the emergency room in crisis. But right now, with menopause, one of the hot topics of the day, we're talking about management issues as well as these definitions. So everybody sits somewhere around menopause, because if you're not in menopause, you might be perimenopause. There are some who are early menopause, and a lot of these have ages associated with them. So the very first thing to know is that the average age of menopause, or the mean age of menopause, is going to be around 51. But we tend to see menopause ranging between 45 and 54 years of age. So if you are younger than 45, you could be in that perimenopausal range or sitting right around there. Or if you are above 54 and you're having bleeding, then you are postmenopausal with bleeding, which can be a more severe issue. So when we talk about menopause, we first have to define that menopause means 12 complete months without your period. All right. So if let's say you had 10 months with without your period, but then you bleed on the 10th month, guess what? The clock starts over if you're not there yet. All right. But at the same time, you need to let your physician know, because we need to know what's going on for you. So 12 months, definitive, no menstrual, you're in menopause.
So if you don't have your, I'll call it normal period, and you haven't gone 12 months straight without a period, but you may have a period in between there, then you're perimenopausal. Is that the case?
That would be the case. We would call that perimenopausal bleeding, but it's a diagnosis of extinction, meaning that we want to make sure there was no other reasons why you were having that irregular or abnormal bleed first. So definitely, whenever you just see your cycle, being irregular, we want to discuss it, and we want to make sure that we're getting a good history from you and understanding the reasons why, because there could be other reasons why that's happening beyond menopause itself.
Are there tests that you can take to find out what stage you're in?
Honestly, a lot of people come in the office and they ask for a hormone test. I want that hormone test. I want that test that's going to tell me I'm in menopause or not. As we move into menopause, the history is the number one factor that's going to play a role in diagnosing menopause. But if we are really curious, we can start to look at the ovaries and one of the hormones that the ovaries secretes, and follicular stimulating hormone. And we can look at that number. And as that number starts creeping up, then we can start to realize that they're not in those reproductive years. The ovaries may not be functioning the way that they used to when they were younger, and they're moving into menopause. And that number would be like a 30 and above.
So what would be symptoms of perimenopause?
Irregular bleeding. Sometimes patients come in, they said, I always got my period every month, pretty like clockwork, every month on a regular basis. But I'm starting to spread out a little bit, or, it's starting to be every 45 days. When we talk about a normal cycle, we talk about 7 days, 28 days is the perfect textbook cycle, but 7 days plus or minus, so 21 to 35. So with that being said, if somebody's starting to range into the 38, 45, they're creeping out there, they're finding that their periods aren't coming as frequently, that might make us consider that they're in the perimenopausal stages as well.
Or what if they are coming like, 2 periods in a month or that kind of thing?
Some dysfunctional bleeding can occur when that's happening. That deserves a workup, because it could be something other than just simply perimenopause.
Are there other symptoms with perimenopause
I'll
besides?
tell you. The symptoms of menopause, just going right into it, the symptoms of menopause, sometimes, you start getting those hot flashes. You get cold night sweats, you can get the mood swings, where you're just feeling moody all day and don't know why. There can be issues with feeling foggy in the brain, not having the energy that you used to have. And the one that gets a lot of people, weight gain, especially in that midsection area. So all of those things could play a role too. They can create, that issue even before you've seen your 12 months without a menstrual.
So what about I know we talked a little bit before we got on this Zoom, on Facebook I should say, about the psychological impact of menopause. Many women struggle with feeling not in their bodies during this time.
Right, right. I will tell you, one of the key issues that a lot of women have, and estrogen, when it's depleting, they find that they're not sleeping well. And that can really push them into more of the mood disorders, because people who don't sleep well have issues with energy. They have issues with depression. They have issues with anxiety because they don't have that reserve that they should have. And so all of those play a role in menopause. And when you really look at an individual holistically, you kind of want to ask that in the history taking portion, because we want to know, like, what's changing in your world? Why is it that you have come to me today to discuss this? Because if you actually made an appointment and drove yourself to our offices to sit down and have this conversation, it means something to you. And we really want to take time to get to know where and get down to the nitty-gritty of what are those changes and how can we best help you. So all of those things, the anxiety, depression, the mood, the lack of sleep, relationship issues, because it's associated with that. Also, let's not forget libido. Libido is decreasing as well as you go into menopause. That could be more of a combination between the estrogens and the testosterones in our body, but nonetheless, it's still a menopausal symptom. And it's a very big one because it plays a great role in relationships. So if relationships start breaking down, whether that be at work or at home, it can be an issue. And that those are some of the emotional issues that we hear about in the office.
So it was interesting when you said foggy brain, because when I think about foggy brain, like I think about COVID and after COVID, right? Like that is one of the like effects of, after having COVID, and energy levels as well. So do you believe that COVID, if you've contracted COVID, can that have some correlation between menopause and your symptoms and those type of things? Just curious.
You bring up a great point. The studies, though, have been looking at some other things in relation to menopause, as well as in our reproductive age women who are menstruating. But one of the things that we've seen a relationship with is cycle changes. So seeing your cycle come more frequently or irregularly, even after an immunization, a vaccine, you can get a cycle change as a result. So we have seen changes in cycle. Episodes of postmenopausal bleeding. There was a study done recently, and the article said that there wasn't a deep correlation, but it was curious enough for them to actually do the study. So clearly somebody had put out the hypothesis and thought that there was some curiosity there as to what's going on with some postmenopausal bleeding that may have occurred, after COVID. But no, there is a correlation between cycle irregularity.
So I guess the other question that I have is, we talked a little bit about some of the symptoms that women experience, whether they're perimenopausal or, full-blown menopause. And what are some things, I guess, that women can do to mitigate these symptoms that they're experiencing, because it's causing hardship for for a lot of women.
Yeah, oh goodness. So let's kind of go down the list, because I want to take each one, in its entirety to give it value. But let's start with those hot flushes and the night sweats, because number one, hands down, that's the number one thing that women complain about. It's the number one thing that causes them to lose their sleep at night. And it kind of parlays into other symptoms as well. But, how do we best mitigate that? With medication. We can talk about exercise as a resource, eating well, weight loss, because we have seen a correlation between obesity and worsening of symptoms. So weight loss, weight control is going to be really great in terms of improving symptoms as well. We look at what resources we do have, and lately we are able now to discuss more frequently and more avidly hormone replacement. So it's on the table. We had a period of time I guess it was around 1990, 91, where a Women's Health Initiative study was done, and they felt that there was such a great correlation between heart disease and breast cancer, as well as blood clots, that we had to stop all estrogen. Those studies have been kind of investigated in terms of the quality of the study, the value of the study, and they found that in our younger women, meaning our younger menopausal women, those women between the ages of 50 and 60, even as high as 65, we are finding that there is great success and without high risk in giving and providing hormone replacement. The rule of thumb has been to give it early and for as short a period as possible, because we don't want people to get overexposed. But at the same time, the benefits outweigh the risk in the majority of patients. There are very specific patients who are actively dealing with breast cancer that may not be able to do this. But at the same time, the majority of women can receive some type of care, whether it be hormonal or a medicinal care, because they want something like a antidepressant, which can sometimes be helpful, not as helpful as the hormones, but it can be helpful, or even an antihypertensive like a clonidine that can also deal with some of those symptoms of the hot flashes and the night sweats. So there are medications out there that we're using that are really helpful for women and hitting on those areas. If you want to go that non-medicinal route, taking you right back. Exercise, improved eating habits, decrease your alcohol, decrease your sugar intake. All those things are triggers towards those hot flashes. Work on the weight, bring the weight down, because it really does make a difference. Not only does it make a difference with those menopausal symptoms, but it also decreases your risk for heart disease. So it's even, it's like a cure-all in many areas. Of course, smoking also. We found that people who smoke have higher levels of vasomotor symptoms, which is the hot flashes and the night sweats. So we want people who smoke to, decrease, hopefully stop, but decrease at least. And, also look at the diet.
We have a question. It says,
Sure.
are there natural remedies other than medication? Exercise and weight loss is good, but what about vitamins, etc.? And
One of the
I'm sorry, Amir, you want to jump in here real quick?
Yes, I had to switch devices because my other devices, it was acting crazy. Can y'all hear me?
Yes.
Yes.
Okay. So I wanted
Uh-oh.
to add some of my personal, oh, am I frozen or something? Am I good?
Now you're
Okay.
good
I hear
now.
you.
So I wanted to add some of my personal advice and some of my personal experiences with the perimenopausal symptoms. So one of the things that I used to teach nursing students to do when they have patients who have some symptoms of a lifestyle or something like that, like a headaches, migraines, things like that, to create a diary and write down like your symptoms and then write down like some correlation. So if today you had, I don't know, you counted how many hot flashes you had, and then you evaluate your day. What did you eat? Where were you driving? Were you walking? And what activities, things like that. And then you start to make correlations in your activities and your diet to determine like what's the triggers for the hot flashes or the symptoms, because I know there's hot flashes, there's night sweats, there's mood swings, there's brain fog, insomnia, all of the above. And for me personally, the things, because when I experience, I'm like very intuitive when it comes down to my body, and I like to take a more holistic approach. For me, what I've noticed helps, or what I notice what my triggers are, if I drink strong coffee, like if I had coffee that was, because I know that caffeine can be a trigger. If I had wine, specifically red wine, I know that that could be a trigger for me. And the solution, so those are the triggers that I noticed for myself, but a solution for me is, as Dr. McDonald, I can't see, I'm on a phone, had stated, like, you have to ways to like balance out whatever your triggers or your hormones. So for me, Fasting. Fasting helps with hormone imbalances in general. Um, some people feel like fasting is extreme, but it can be a significant solution that's holistic, because a lot of times when we start getting older, the symptoms and issues that we have because we're getting older is because of hormonal imbalances. So hormonal, the fasting, exercising, and making sure that you maintain a healthy weight has, for me. And also, oddly enough, and I don't know, I stumbled across this year, weightlifting for women.
Oh, yeah.
Weightlifting has has had an impact on how
Mhm.
many symptoms I have during the day.
Mhm.
Great. That sounds good. Those are all really good
Mhm.
pointers. And so when you fast, I'm just curious, how long do you fast for?
Well, it depends on, if I feel like I need a significant detox, I can fast for 3 days. I could do a water fast for up to 3 days. But if
Whoa.
I'm just like on like a yeah, that's why people think it's extreme. Um, but if I'm just, feeling like I need to take a break from constantly um, eating or thinking about food or preparing food, and I'll go maybe like 16 or 18 hours fasting.
Mhm.
I
We have
do. Oh, sorry. Go ahead.
we have some more questions real quick.
Mhm.
Another question is there a risk with hormone replacement therapy treatments that may trigger cancer risk? Sorry if you answered this. I think we talked about this a
Yeah.
little bit. Um, so
Well, one of the things to just mention is that in a well-selected patient, which are the majority of women, if you believe it or not, you can enjoy hormone replacement therapy without issue. But we try not to overuse it. If you start to use hormone replacement therapy greater than 5 years, that can increase your risk. So we are always monitoring, and we use something called shared decision making with our patients, because many of women, they're very impressed by the improvement in their symptoms and they want to continue. And so we have to make sure we educate them on what their risk could be, and we base it on their family history along with their personal history as we discuss it with them. And they can make that decision with their provider as to whether or not they want to continue if they're going that route. And we always do try to start with some of the non-medical managements, and we discuss it. But I can tell you, I could sit there and want to do that, but my patients come in there and they're serious. They're like, you need to give me something that works right now. I want this right now. And so we end up talking about all options, and wherever they sit is where they sit.
I
the
like the journaling option. I mean,
yeah,
Yeah.
between you, I think that is, I've never heard, I mean, they say, when you want to lose weight, journal, watch, but really to like be purposeful, very intentional about, I have this symptom and this is what happened during the day. That's
mm,
amazing. I think that's an excellent suggestion for especially someone that's in the beginning stages, like the perimenopausal phase, because you get to be more in tune with your body
Mhm.
and really identifying those triggers, right?
mm.
And so maybe, then you can make some adjustments. I just think that's a great suggestion too. Um,
It allows them to take ownership. So I really love that.
yes,
I love
full
that.
ownership. Yes.
Next question is it possible to be menopausal or in menopause without hot flashes and night sweats?
Hmm.
What are other indicators of menopause besides night sweats and hot flashes?
Yeah, that's a great question, and it's absolutely true. Some of the, beyond just thinking about those night sweats and hot flashes, a lot of women come in with urinary changes because our estrogen affects the way our pelvic floor performs.
Hmm.
One of the things that estrogen does, it allows for there to be more elasticity in the pelvic floor, and it allows there to be more strength, of that pelvic floor. So if you start losing estrogen, you're also losing something called collagen. Collagen is that peptide that actually allows for the tone that we have even in our face, you know. So we have that issue vaginally too. You know, we're losing tone, we're losing we're getting dryness as a result of that as well. So you can imagine if things are changing right around the bladder area and the vagina and the urethra, you're going to have issues with the way that you urinate. You could cough, you could sneeze, you could lose urine because you've lost tone in that area. And we call that incontinence. It's all part and parcel of aging for many women. It's not, you know, it's predisposed with sometimes deliveries that have been heavy, with large babies, I should say. But some of those women are predisposed, but sometimes it's just genetic. Sometimes you just have a genetic predisposition. And, you know, that loss of estrogen kind of takes you into that realm. So we call that genitourinary syndrome. And that's an issue that women come in with as well. And we can relate it to that. So how do we treat it? We use a topical, we use a cream. It can be an ovule or a cream that applies right into the vaginal area and affects the region. So it creates more ability to gain more tone and elasticity in the area, and it allows you to strengthen. We also do pelvic floor exercises with those patients, Kegel exercises. We have physical therapy now that I can tell you I've sent more patients to physical therapy in the last 5 years than I had, you know, and I've been practicing over 25 years. And, you know, it just wasn't something that was as big, but more and more physical therapy programs are providing the services for pelvic rehabilitation. And that is something that we can do with our patients as well. We work in partnership with the physical therapy teams. We look at the need for surgical management because sometimes that pelvic floor is causing prolapse or other issues because of the weakness of the floor and the uterus is moving forward. So that could be an issue too. All of this is related, but it takes, based on the degree, we decide what level of support we need to give you. And if we do need to do surgical support, we go to our super specialists who are doing vaginal procedures, and we refer the patients that way as well.
We got more questions. So I think we were just touching on this one. How can we strengthen our vaginal muscles? But then there's another one that says, does menopause affect hair loss? That's a good one.
Oh, yeah. All right. So there's a lot of different ways that can do that. Look, Amira, kick in any moment. You want to talk about that one?
Yeah, definitely with the hair loss, and not just like, you know, hair loss that's obvious, but your hair can like thin out significantly where you had luscious long locks, and then all of a sudden, like every time you go to wash your hair or brush your hair, like you see thick thick amounts of hair being pulled out into the brush, or like when you wash your hair, like you notice the drain is more full than usual. But yes, it all has to do with the again the hormonal imbalance, the loss of the estrogen that we once had when we were young. And it's funny because it was something that I wanted to add when we first got on here, started talking about perimenopausal. I don't know if anybody saw the video from Auntie Tab when she was talking. If you didn't, please look it up. Please Google it because it's funny. She was talking about Perry. She said, who's Perry and who invited her here? Because she was saying it's just hot. It's just hot. I'm tired, but I can't sleep, and I'm just hot. And she said she was just talking about all of the things with perimenopause, but the hair loss, well, just menopause in general. And I just want to also add this about the hair, and then the menstrual irregularities. Sometimes with, and I think it adds to the depression that it's all of the things that makes us identify as a woman, and all of that is being impacted by us getting older. And a lot of times people look, try to stand against ageism and getting older and, being trying to empower women. But it's a tough time when, again, all of the things that make you feel like a woman is slowly dwindling. And I think somebody else talked about how sometimes we look at the stress of having a period every month and we have cramps and all of the other symptoms. But then when the period is starting to go away, it's almost like you're losing your best friend, or you lost your best friend, because it gave you what you felt like was your youth. But I'm sorry, I went off on a whole tangent, and the question
Oh,
was
no,
about
that's good.
hair loss. But yes, it has to do with yeah, the hormonal imbalances. And I noticed that when I deal with the symptoms, that my hair has thickened back up when I dealt with the symptoms, based on my journaling and being intuitive and paying attention to myself. Some of the symptoms have
Mhm.
been relieved.
Yeah. One of the things that tends to occur in menopause is that our estrogen levels are going down. So that ratio between testosterone and estrogen is going like this, so our testosterone levels are higher. So some of the symptoms we start to see are some of that male pattern balding. Women who are more sensitive to that testosterone may find more breakage in the midsection of their scalp. They may also see issues towards the front, like right in this frontal region. Those are the areas that we would deal with. So here we go, partnering again. We're sending our patients to dermatology because now you need to have some management. Dihydrotestosterone, which is basically something that works very well for patients, is something that they share. They can take a look at the scalp and ensure what their needs are, if they might need a steroid of some form. But either way, what they're doing is they're helping to manage those symptoms. So, one conversation can get you kind of centered into where you need to be in terms of the symptoms that you're reporting. So having those conversations with your gynecologist are really important, and don't hold back, make sure you talk about
Mhm.
all aspects, because, we partner with multiple providers in order to manage menopause. It is not a single faceted issue for us as women. It is multifaceted. It takes multiple hands to manage this menopause. And, replacing estrogen is just one thing. Replacing testosterone is another. And when we talk about hormone replacement, for women, there are methods by which we can replace testosterone. So if we're going to start talking about testosterone, then I'm going to take us right in, because testosterone loss or testosterone deficits are what cause decreases in libido. And sometimes you need a little testosterone in menopause in order to even improve your sex life. So, we talk about that too. Many of women may find that that's really a bigger issue for them than hot flashes, night sweats, or pelvic floor disorders of any form. They're concerned about their relationships. They're concerned about how menopause has affected them in their relationships. And we have to talk about how we can help them with that as well.
And back to the hair thing. What about the extra hair you get like all over your face and stuff?
Again, it's that ratio, that testosterone's a little higher. So here we
Mhm.
go now with depilatories. Either you're using a cream, shaving, what is the other one? Waxing, and now laser has become really big. There are laser centers opening up all over the place because people are concerned about the way they look, and they're concerned about all the extra hair. And so those laser centers are getting good business, even from our menopausal age group women.
Yeah.
Mhm.
And we have another question. What effect, if any, has COVID had upon women in menopause?
We touched on that earlier, but I don't know that there is major data to support that COVID is affecting women in menopause more specifically than they're affecting any other age range individual. That long COVID scenarios, maybe it's prolonging some of the symptoms that are maybe triggered by menopause. But I will say, I don't know, Amira, if you want to speak on that. I don't have any
Mhm.
data to support anything distinctively.
I, I'm gonna echo what you said. There's not enough research out there on it.
Mhm.
I can see, like, if you're thinking about it, I don't know, scientifically, you can relate. Like, if you're already having some memory issues, you have two different things that can cause some cognitive issues. I could see how people would think that they were related, but to back it up with the facts, we don't have. There's no data out there to support it.
This isn't necessarily about menopause, and I probably shouldn't go off on a tangent, but is anyone aware of a study about if the vaccines are causing any type of blood issues or um any kind of breast cancer in women or maybe even men, breast cancer, um, a
There
height.
were articles. There were actually articles out. And one of the things that we have seen and we've supported at this stage is, of course, in our reproductive age women who are menstruating, that there are menstrual irregularities associated with the vaccines. They are
Mhm.
actually having their period more frequently following a vaccine, meaning that their intermenstrual bleed, basically, is what we call that.
Mhm.
And we have to ask in the history, have you received a vaccine recently? Because now it's a valid point that that could be the cause. And then you know how to manage the patient if you want to be more expectant, and just kind of wait and watch and see versus, being a little more assertive and saying, oh, let's do an endometrial sampling or do something like that. You don't want to be invasive if you don't need to be. So we try not to do that. So if we get a little history, because we have seen a correlation between menstrual irregularity in the reproductive age woman. The other thing that you mentioned about the breast, there was a study done, and I cannot remember if they felt that there was a great correlation, but I did read the article about data of after a vaccine, this patient having to have a diagnostic mammogram more frequently. They didn't find anything after the diagnostic, but they were seeing these phantom shadows that they were concerned about, and radiologists were finding that they were sending more and more women for diagnostic mammograms after doing routine studies.
Oh,
That's
wow.
very interesting. Thank you. And a
Mhm.
lot of what I was thinking. So thank you for that.
Yeah.
I think we already addressed this one, but just in case, did she address memory and how menopause affects your memory? We talked about brain fog, so.
Yeah. And going right back to that lack of sleep. If you can't sleep, how can you think, if you're not sleeping well and then things aren't clear, memory's not clear. So there's concerns about that that lack of sleep with the lack of estrogen is an issue. We found that the replacement of progesterone also aids in the sleep cycle, so that and for many of our women, if we're replacing estrogen and you have a uterus, we're going to replace your progesterone. So that combination has been extremely effective in improving sleep.
I got a question about, and I think we touched on this a little bit about if we are fortunate enough to ask our mothers questions about their own menopausal journey, what things should we focus on? Like what should we know about them? Age, is that important? Is that
Yeah.
commonly a good indicator for the daughter? Or what other things should we know or ask?
Tamara, did you want to touch on that one?
Oh, that's a good question. Yes, we want to know, we want to know the age that they started, or menarche that they started, or we don't remember when did we start, because there's a timeline between when you started and when you could potentially start to have perimenopausal symptoms. Um, so the young women who started their menstrual cycle, I guess around 10 and a half or 11, they could start having perimenopausal symptoms in their late 30s,
Uh,
40s. But the interesting thing for me, I really couldn't have that conversation with my mother. My mother is alive and well, but my mom had a bunch of twins. Well, she had two sets of twins. She had other kids, and she had a lot of, she had a history, female health history that led her to have a um, hysterectomy early in life. So she had a hysterectomy in her early 30s. So and when I ask her about her menopausal symptoms, she doesn't remember. I'm sure she probably had some symptoms once she had her uterus removed, but she doesn't remember. So she did, like, I couldn't talk to her about, what should I expect in reference to my history for what's going to happen for me. But I think, in general, again, that's another thing that my I teach patients and also students and people in the community that family history is important in general, like for any health history, like a lot, especially when it comes down to cancer, because that's one of the things that I teach a lot in the community. It's such a taboo topic that people don't want you'll know about the death of somebody having a heart attack or some other chronic issue before cancer because people feel ashamed of having cancer, but we when we arm ourselves with the knowledge of what our family history is, that's how we can protect ourselves from dealing with major symptoms. So I think all of us, if we're blessed enough to have our parent, our mother and our grandmother, we should have a conversation with them about what their menopausal, perimenopausal history is so that we can prepare ourselves and make informed decisions for, when we go to the doctor, if we're going to decide if we're going to take medications or if we're going to go the holistic route or prevent any of the symptoms altogether. Not that I think that that's possible, but prevent some of the symptoms that disrupt our lives. We can make decisions about it before it even happens.
And I was going to just ask you that because this is an intergenerational show, are there things that younger women, younger than all of us on this screen, of the younger age, are there things that they can do to prepare themselves better for menopause? I'm talking about, like, I don't know. I don't even know what it is, but I'm just saying, is there something that we don't know that when you're a younger woman, it might be good to do other than maybe working out and being active and that sort of thing? But are there dietary things you could take, like special vitamins you could take? I'm just guessing or
You
making
know,
up.
we talked a lot about how exercise and weight management is really important, but beyond that, supplements. When you think about your vitamin D levels, our vitamin D levels as African Americans are very low, and for whatever reason, because we don't absorb from the sun the same way, our D levels tend not to be as high as others. But we have found that vitamin D plays a nice role in improving symptoms for many. So if we're maintaining levels that are normal from youth onward, as we move into that menopausal stage, that is a supplement that really can work for folks and make sure that they don't, it doesn't drop. It has multiple benefits, vitamin D. So it plays a great role even in cardiovascular health as well, and immune system health as well. So it plays multiple roles in our life, and we need to really look at that as a vitamin that we really need to keep up. Taking the history, again, knowing, how early did mom have her first menopausal symptoms. Also, that helps because it allows them to navigate around that stage of their life a lot easier. And it helps us because they come in and they give that history and we know what to do. I'm an advocate of definitely symptomatic managements. So I find that women who are having irregular bleeds at an early age, or women that are having issues with the hot flashes earlier than menopause for themselves, like you're not necessarily perimenopause, but we find that they're in their 30s having some of these symptoms because it can happen. There may be ways that we can support them with hormonal management as well during those early stages. And we also base that on their reproductive goals because some women want to get pregnant. And so pregnancy is a great relief for cycle irregularity because you can help them through with that as well. So we base it on their goals too.
Mhm.
I will
I-
also add,
Go ahead, Amira.
don't know how Dr. McDonald feels about this one, but magnesium supplements have been been talked about a lot, like especially in reference to menopausal women. And I know that it helps me. I haven't really looked into the on it, but just in general, magnesium is one of those supplements that's um, it ranks high for professionals who are into like holistic remedies for symptoms or issues like menopause.
So magnesium.
Yeah. Magnesium is very calming, actually. Yeah, that magnesium is high up there.
Good. That's a new, I
Yeah.
definitely take
You
vitamin.
can you can have magnesium as a tablet or as a powder, and you can drink it as a hot drink right before bedtime. It's very relaxing. It helps with sleep. Yeah,
Hmm.
I agree with you. It's a nice one. There's a
Yeah.
product called Calm that I enjoy even. It's really nice. And it comes in flavors. So, it's not it can be tasty too. Yeah. Mm.
Hmm.
Well, this isn't a question, but we have a comment that says, I think business leaders need to hear this. It may help how they judge seasoned employees. I agree.
I agree on that.
I think that
Yeah.
this conversation is excellent. I think that, and I was sharing with Dr. McDonald before we streamed live that there, up until now, like this generation, there really hasn't been much talk about menopause, the symptoms of menopause, or some of the things to treat menopause. It was like a taboo subject, right? So, which is why many people don't know the history of their parent, their mother, or aunt or grandmother, because it just wasn't something that
Hmm.
a conversation that we engaged in. But women are suffering, and I'm glad folks are talking about what they're experiencing. We're exchanging information, which is what this show is all about. But beyond the show, you can find many a woman in our age range talking about menopause and what are you taking? What are you using? How's it, impacting you? Put the fan on. It's hot in here. Open the window. All of that stuff. So it's great. I think this is long overdue. And the more conversations that we can have like this, the better, the more informed we become. Who knew about magnesium? Vitamin D, yes, but I didn't know that magnesium was calming, right? So something to try.
We
Yeah.
have another question about
Hmm.
vitamins. Is vitamin D plus vitamin K2 best for African American women? And that's actually the one that I take. So I'm interested in this answer.
Yeah. As far as I know, there is also a combination with vitamin A, vitamin D, and vitamin K. That's a great supplement.
AD.
For
Okay.
Yeah, the combination of the three. And you can get that, at your local vitamin shop, or it can be, I think it can be prescribed, but you can get it over the counter as well. Mhm.
Hmm.
We have another question that says, does magnesium mix well with champagne?
Oh,
That's
I
funny.
would I wouldn't have to answer to that one. I don't know. I wouldn't suggest it. I mean, I do know that I've heard doctors tell people to take a magnesium after a night of drinking, after, not with, but after. It can help with recovery.
That's
I
funny.
think it's magnesium and a B complex you could take
Uh,
after a night of drinking to recover.
with their
I
IV
don't know about with
hydration.
though.
Well, always remember, don't overdo magnesium or else you'll find yourself in the bathroom because it can cause you to have
Oh,
and
oh
loose
yeah.
stools. Yeah. So be mindful not to overdo it.
Awesome.
I will try the magnesium for the calm. I like that.
Mhm.
Mhm.
Yeah.
Calm is good. I was also gonna add to your comment, Jeanette, that I think this conversation should also be had with our men and our male children so that
Mhm.
they can learn to be empathetic and have an understanding of yeah, what mom is going through. You
Yes.
know, I don't know what sister is going through when, she wants them to be left alone for 5 to 7 days. So I think, the taboo part is that a lot of times these conversations are just had amongst women, and because we feel like women can only understand what women go through, but men need to understand it as well. They need to
Mhm.
know so they could be supportive and empathetic.
Great.
Yeah, I agree with you 100%. One of the things that I talked to again, um, Gail and Cara before we got on here live,
Mhm.
there was a very good male friend of mine that his partner was struggling with menopause.
Mhm.
And so he, like I was like, oh no, we're gonna have a show about it. Just wait. But his,
Mm.
she struggled, and then hence he struggled. And he's like, sis, I don't know what to do about, you know, my partner. Her body is changing. I still love her the way it doesn't matter to me, but she couldn't get out of her she was having like she wasn't comfortable in her body, and it caused lots of problems in their relationship. So
Yeah. And we touched on that a little bit, and it goes right back to some of the changes that occur in menopause. Your stress levels, the way that you deal with stress, your cortisol levels go up. And that's kind of what causes a lot of that weight gain in the midsection. And for a lot of us, that's a very sensitive area. We don't
yeah,
want to see our waistlines
no,
spotted. And so we only need to know how to combat that. A lot of women come to me and they're like, I work out 5 times a week. I
Mhm.
do everything and everything. I'm doing my strength training, I'm doing Pilates, I'm doing this, that, and the other, but I just can't seem to lose the weight. And so we have to start thinking about other aspects. So that cortisol response is something that we look at very closely as well. And again, we're looking at how we can support them with cortisol support. Again, it's a medicinal thing. We're looking at medications, but I will tell you this, estrogen. Again, we're going right back to where I started. Estrogen really helps with waistline weight loss, so that we can slim down a little bit better. It just makes it that much easier. But it's a combination, cortisol and
I'm
estrogen.
gonna add all about the hormonal imbalances. I'm gonna add a little bit of spirituality if I can. But one of the things that I feel like us as women that we need to continue or to take on when we start going through these different changes in our lives is we need to have self-love and positive self-talk.
Mhm.
Because if you have to affirm, that you love yourself and that you look great, and I still love you no matter what, to ourselves, because it's difficult. It's difficult for somebody else to have to uplift you and give you positive self-talk if you don't believe it yourself. Like, you have to believe it yourself, and you have to, like, we can affirm good health. We can affirm positive body image. We can affirm, just overall holistic mind, body, and spirit. But we have to, like, during these times, it has to be more intentional than other times, because if I don't believe in myself, or I don't believe it within myself, no medication, no supplements, no partner, no nothing is gonna work for me, because I'm going to already have I'm going to already be defeated.
Right.
mhm.
Great point,
I'm sorry for
Amira.
the tangent. My soapbox.
That
100%.
was great. That was really
Mhm.
good. And definitely you're speaking to self uh, you know, self-esteem and encouraging yourself. That's very important. That's a big part of self-care.
Yeah. And having networks just like this one where we can actually talk
Mm,
about it. I mean, being able to discuss menopause in all its facets, because there's so many,
Right.
and knowing that other people who can relate to you are there in that circle, creating these sister circles where we are discussing things and looking at solutions and seeing how they really work for everybody, because they do work. There are solutions out there for everybody who is dealing with symptoms of menopause. So seeking out their provider, if they find that the conversation is too difficult with that particular provider, switch providers.
Mm.
Find somebody who you can talk to,
I say
because
that all the
you
time.
need to
Mm,
be
mm,
comfortable talking about the things that are important to you in the office. And, hopefully that provider will not only just hear you and see you, but they will also respond and give you some solutions that really do work. They're out there. They're out there.
Yeah, we had a suggestion on here also that might help people, meditation and yoga. Those are really calming things as well that can center you.
Mhm.
Meditation has helped me a lot,
Yeah.
a lot. Like it's powerful. It's more powerful than people can understand because they think that, they look at they think of yoga as somebody, a yogi sitting in a lotus position with, long hair and half naked. But it really is a powerful practice
Mhm.
because we have so much noise in our head that, especially nowadays with computers and cell phones, and we're constantly on, go, go, go. And I feel like that attributes to the brain fog as well.
Right.
But just taking a minute to remove the noise,
Mhm.
it's powerful.
Yeah,
And
I so agree.
I'll just say that our good girlfriend that was on a little earlier, Regina Clay, has a guided meditation YouTube channel, or maybe it's on wherever you get your podcasts. You can find her with
Oh, you gotta let me know.
Regina
Yeah,
Clay.
she's wonderful.
Yeah, so she has some very nice guided meditations for you on there.
Mhm.
We'll put the information in the chat, but we'll get it to you, Dr. Amira, too.
Yeah.
So I have a
Okay, thank you.
question. How long can a person be in perimenopause and then menopause? Like how long does it go on?
It varies. It really does, because some people start that perimenopause phase, earlier than others. The average individual was hitting around 45. They're going to start that. We said that mean age of menopause is around 51, but there are many people that go all the way to 55 and they're
Mhm.
still menstruating. So,
Yeah.
we're just watching them, where they're
Mhm.
kind of doing, again, monitoring with their physician, especially when they've reached 54, 55, because the average age, again, 45 to 54. We're expecting menopause to kick in somewhere in that time period.
Mhm.
So that's the range.
Mhm.
So, how long can they go? If they start to approach above 55, then we're probably going to do a workup and see where they are and why. Why is that happening?
What if it's normal, or if it's been history in your family? Is that
That's supportive, but nonetheless, after 55, we want to investigate. We want to make sure
that's
that.
good to know? Because is there any correlation? I'm asking for personal reasons now. If you started menstruating at an extremely young age and your family members go into menopause in their 60s, is that normal? And
It's
any
normal for that
correlation with
family. It's a
starting early?
variation of normal for that family.
Okay.
Yeah, and what our job is as providers is to ensure that it is normal. So we're trying to rule out other reasons why that could be happening for you in particular. Taking into account you have a family history, yes, but let's make sure there's nothing unusual going on. So maybe a sonogram, check the ovaries, and check, and see that there's no endometrial changes, lower changes of the lining of the uterus that could be supporting your bleeding. So we want to make sure we know those things.
So do you just go to after 55, your doctor should be checking this? Because
It's part of your annual exam, because we're going to take your history and we're going to get a gauge as to what your cycle has been doing. We get those little yellow flags, red flags come up and sometimes in the discussion, and then we can support it with some testing if needed. Mhm.
okay, cool.
Mhm. What about like the increase of fibroids like during perimenopause? Is that a common thing or?
Well, we find that fibroids grow in the presence of estrogen. Okay.
Mm.
So usually women who are in their 30s and above, that's when we start to see a higher population of fibroids. And then as we move towards menopause and as that estrogen level's depleting, you literally see shrinkage of the fibroids, and
Mm.
they show up kind of like calcifications because they're called the old fibroids, and they start
Mhm.
to what we call degenerate. And so we actually suspect that women are who have fibroids that did not obstruct them from reproductive lifestyles and did not create issues with them. So they're going right into menopause with the same fibroids they went through the reproductive years with. They didn't need surgery. They didn't need a hysterectomy at that stage. Well, we can let them gracefully go into menopause with those fibroids with the suspicion that, or the expectation that those fibroids are going to shrink. Now, a fibroid that is growing in the presence of menopause, without the lack of estrogen, without the presence of estrogen, is considered to be a cancerous lesion until otherwise noted. So if we see a woman who has entered menopause and she has what she says, oh, but I always had fibroids, but now we're seeing that a 2 centimeter fibroid is a 4 centimeter fibroid, and we follow it and see that, then we're going to be concerned, and that might be surgical management at that stage, because that could be what we call sarcoma. And we're concerned about that.
You know what? We've talked about menopause, but what about postmenopause? What should we know about that?
So in terms of symptoms, or in terms of
Yeah, like, are there things that we should that happen after, like, hot flashes, they stop, I guess, after postmenopause?
well, no, postmenopause, early years. Let's put it, we can put it into stages: early postmenopause, or early menopause, postmenopause, and late. Expectation is, especially in African American women, those hot flashes, they can be prolonged. The average woman, Caucasian woman, is what, about 4 to 5 years. For African American women, it's up to 10 years that you can have these
Yeah,
menopausal symptoms. It's like
Why?
double for
Why
us.
is
I've heard of 15. Yeah,
You heard
that was a
15?
long
Yeah,
time.
it's a
Yeah.
bigger number. And I will tell you, these are the times that these women are feeling it. And so they really need help going into postmenopause seasons gracefully. The lack of sleep in postmenopause because of that, the lack of the insomnia, or the inability to relax, all these things are postmenopausal issues that we're managing. So the genital urinary syndrome that I mentioned earlier, these are all postmenopause, and I'm talking taking you right into your 70s and 80s. Okay. These are all symptoms that we have because we're getting that vaginal dryness, we're getting those changes on the pelvic floor, and many a women can have more symptoms as a result.
Wow.
Yeah.
There's
Oh, I didn't even talk about headaches. I'm sorry. Headaches is in there too. Some
Oh my
women who have
goodness.
migraines, they can have worsening of those symptoms during postmenopause. I mean, I'm not making menopause sound pretty at all, but that can be there as well. But that's a whole other issue that we try to combat. And we kind of touched on it with the hair, but we didn't really talk about the skin. You see all these aesthetics going on these days. That's because our collagen levels are dropping. So what are we seeing? We're seeing drooping eyelids. We're seeing drooping faces. People are really concerned about their aesthetics. So they're actually, seeing their dermatologist, because that lack of estrogen is also changing the way they appear. And going back to what Dr. Amira was saying about self-love, it's like, hey, I don't like how I feel. I don't like how I look. Well, some women are taking that initiative to create change in their own lives, and taking steps towards improving their collagen effect of the skin. It's not just so easy just to eat and drink collagen and get these changes. So sometimes you have to visit your dermatologist and discuss it with them, and they can be ancillary in supporting you with those types of things.
menopause sounds very expensive.
Yes, and that could be close.
Can we talk about bones, like
Mhm.
softening bones, and what can we do and all that kind of stuff? That
You want me to go on to that? So osteoporosis, osteopenia is, these are all definition or words that require the definition of the weakening of the bone, or the decrease of the calcification in the bone. And we find that lack of estrogen also plays a role in osteoporosis. So, we are concerned about bone strength. So when you go back to the discussion we had on exercise, strength training, that strengthens the muscle around the bone and strengthens the bone indirectly as well. So we want to do that. Magnesium, when you talk about magnesium, what does it do? But it allows for more retention of calcium. So that allows us to also retain bone strength as well. So, there's a link between that magnesium as a resource for menopause symptoms, but it also helps with other secondary symptoms like osteoporosis and osteopenia. So as you get older, and also if we look at risk factors as well, we start screening for bone density. And those bone density studies are utilized in order to suggest whether or not we need to put you on calcium. Again, let's go back to vitamin D, because calcium without vitamin D doesn't get absorbed well. So we want to have calcium in combination with vitamin D as a supplement. So you're going to hear conversation about that as well. If you have a history of fractures, if you have a history of high cholesterol or heart disease, these are all higher risk factors for osteoporosis as well. So when we're getting your history, we're also in our own minds as providers deciding whether or not you need to get your bone density early, or if you can wait till after 50 and start your bone densities at a later age.
Are there, I just thought about this, like, are there any diets that, and when I say diet, I'm not talking about diet just to lose weight, I'm just talking about eating, how you eat, or foods you choose to eat, I should say, that are better for a menopausal or perimenopausal women, like with um, I'm making this up, high fiber, I'm just making stuff up. High fiber, I know protein's always good, but is there like a vegetarian, pescatarian, like anything like that that's
You know,
helpful?
There were studies, and I know, Mary, I know you can attest to these, the blue zones that are in
Oh my goodness.
the world. There's these blue zones, these regions where people are living longer. And what they found is that these are the ones that are eating like almost like a Mediterranean diet, where they're
Mediterranean
eating
diet.
more
Mhm.
vegetables and they're eating a lot of greens and a lot of plants, let's say that. And they're not necessarily vegetarian, but at the same time, they're getting a good
Mhm.
portion of their diet from the kind of the Mediterranean stylings of eating. So with that being said, we found that people who are able to eat higher fiber, high roughage diets, high and high protein as well, they are doing very, very well. And that should translate to all of us to say maybe that's the kind of direction we want to go in for healthy eating, even as we're aging.
Less symptoms of
I can add to that.
menopausal symptoms with those diets too?
Mhm.
Um, Healthy eating it actually improves your menopausal symptoms. So decreasing your alcohol, decreasing your sugar. Sugar is a big trigger for menopausal symptoms. Believe it or not, we all love a cookie, we all love a piece of cake, but sometimes it doesn't love us so much, especially in menopause.
Mm-hmm.
Yeah, please, Amira.
I was gonna add to, I don't know, oversimplify it or undersimplify it. Eating foods that looks like how it came to this planet.
Mhm.
So eating foods that are less processed. So if you're eating an apple, it should look like an apple, not an apple pie, not an apple strudel. If you're eating, um, if you're eating, I don't know, I don't eat meat, but if you're eating chicken, it should look like it came from a chicken, not a chicken nugget, not a chicken strip. So I think that's what happens in those blue zones. They eat food that don't come in packages with an ingredients list. They don't come in, it's not processed. So to oversimplify it, eat things that look as close to nature as possible. So and I'm even though I'm a big proponent of not eating things that have a mother. That's how I explain it. I don't eat things that have a mother. That diet, like telling somebody that they should eat a specific diet, vegetarian, keto, or whatever, it's not for everybody. We're all different. Our genetics is different. But nobody can argue that processed foods is healthy.
Yeah.
Nobody can ever argue that processed foods is good for us. So less processed foods. Um, can just improve your overall health, including menopausal symptoms.
I have a question about arthritis and menopause. Like, is there any connection between, um, women that are in that perimenopause or menopause and the increase in arthritis?
Mhm.
I don't have any data to support that. Aging in general would be a confounding factor.
Mhm.
I don't know, Dr. Mira, if you have anything to add to that. I actually don't.
No, I think I agree that it's things just wear out as we get older.
I just
Sometimes
saw
family
Age.
history plays a
I
role with
don't
that.
know any correlation.
Mhm.
Mhm. Yeah.
Yeah.
Any more questions out there in Facebook land? If not, we're going to start to wrap this up. I'm
This
looking.
was
I don't
fabulous.
we have lots of comments, but no more. I don't see any more questions. So, well, this is our first episode on menopause. We're gonna
Right.
have part 2, part 3, but this was, I mean, amazing. I'm telling you, this was amazing. So, thank you both
Right. Glad to be
on
here.
and sharing with us tonight. We really, really do appreciate this.
Absolutely.
Yeah.
Awesome.
And we hope that this has blessed some folks out there. We really appreciate all of the engagement tonight. Thank you for all those wonderful questions and tuning in and sharing. And this is how we learn. So let's keep the questions coming and let's try to get some more answers so
Yeah.
that we can all be more informed and inform the next generation. And that's how we will help to take the stigma off of menopause and even discussing it, even saying it. Some people don't even like to say it. So menopause, look, yeah. So
We can move through it gracefully.
I
Have
want
information
yeah,
for you to manage and move through it in a graceful way and
Exactly.
not out of shame because
exactly.
it's part of our
Exactly.
process. So
Yeah,
Yeah,
decrease, improve people's sensitivities to discuss it
yes,
because we want people to talk about it. When we come in the office, they shouldn't be scared to talk about it. Just come to
nope.
us. Mhm.
and I want to say, Kara, thank you for having this platform because it's valuable to have people in healthcare that the community can ask questions outside of the stress of being in office. I feel I do a lot of community chats and people have they're thankful to be able to talk to a healthcare professional that's, the stakes are lower and that, they're not stressed and they're not afraid and they're more open to ask questions during those times than, you know.
Yeah.
So I thank you for having this platform for people to ask questions.
Thank you for that. And that's the whole point of this is that as sisters, we support each other and uplift each other. And I'm still leaning back on your comment about you have to love yourself.
Yeah.
And that's what we're here for, to support people in loving themselves and getting the information so that they can live healthy, happy lives. So thank you both for being here.
yes,
Thanks for having us.
You're
And we'll
welcome.
we'll be back in a next month with our next Good Girlfriends topic. But thank you all. This is going to be posted on our YouTube channel on Good Girlfriends, our YouTube Good Girlfriends chat channel. So please, if you haven't subscribed to that channel, go there and subscribe. But it will be here on Facebook as well for you to catch. But along with the other hundreds of wonderful conversations that we've had, with so much information, you can always find us on our YouTube channel as well. So thank you, everyone. We hope this has been a blessing to you. It's totally blessed me. Thank
yes.
you here. And we just hope everyone has a wonderful rest of the week and weekend. Thank you. Bye.
Night.
Bye, everyone.
Good night.